ROS1 is another gene rearrangement, so it's like ALK, it's structurally related and similar. It's rarer, so ROS1 rearrangements occur in about 1% of non-small cell lung cancer, but they've also been described in some other rare cancers. Gallbladder cancer has some ROS1 rearrangements. In this year's ASCO, we're seeing for the first time a very small percentage of colorectal cancer may have ROS1 rearrangement, which has never been described before. So there's only a certain number of things that can drive a cancer cell. The frequency will vary depending on whether it's breast cancer or bowel cancer or lung cancer, but we're going to get the same usual suspects turning up again and again. The great thing is, because it's so structurally related to ALK, Crizotinib is also a ROS1 inhibitor, and Dr. Wu presented a very nice poster. Great waterfall plot. We're seeing a 50 to 60% response rate. We're seeing durable responses. In fact, Crizotinib may actually be a much better ROS1 inhibitor than it is an ALK inhibitor. So, it's great for that small population of patients. When you get these rare subtypes, again, we're in uncharted territory. I mean, there is no way you're going to be able to do a 600-patient randomized study in ROS1 with Crizotinib versus chemotherapy. It's just not going to happen. So we either just suck it up and say, people with ROS1, I'm sorry, but you're never going to have a licensed drug, or we need to start the conversation with the FDA and other regulatory bodies and say, look, this is a drug we know is safe. We've given it to hundreds of people. We know it works really well in ALK-positive people, and this looks very, very similar, and there is many biological reasons to think it's similar. How many people are you going to need to show that they're responding exactly the same as ALK-positive people to expand the label? And that's a conversation that is ongoing with the FDA. Hopefully it's going to be tens of patients, not hundreds of patients, because the full data set in the world is about 30 patients now.